if you could talk a little bit more about the use of growth hormone in OCNDS when there isn't a true deficiency, and whether or not it can help the children or how it does help them.
Community yet. If people are going to use growth hormone, it would be helpful for us to systematically collect that and see what happens. But here's the way the body generally works. If you're growth hormone deficient, replacing that missing hormone definitely helps to restore normal growth. So that's kind of the basics. To my knowledge, OCNDS is not the results in terms of the short stature or being shorter or smaller or more petite is not the result of a growth hormone deficiency. And so when I've seen the results from endocrinologists, either measuring growth hormone or doing growth hormone stimulation testing, the results come out normal. So we think that the difference is that the body is programmed to grow in a different way, both in terms of final adult height is shorter, as well as if you look at growth curves, it would be shifted downward from what we see for other individuals. If you're using growth hormone, and this comes from not just treating individuals with OCNDS, but with other genetic conditions as well, you can, to a certain extent, override the growth hormone system in terms of giving sort of bonus growth hormone. And when you're doing that, you can front load, if you will, some of the growth. So you may accelerate some of the growth that might have happened later and make it happen earlier. And for certain reasons, that may be, from a social point of view, better in terms of the children sort of looking their age, in terms of their peers. And to a certain extent, depending on the social situation of the child, it may not matter, in terms of whether or not they're mainstreamed in school or, sort of in situations where people are judging their chronological age, what they look like, and, sort of lining kids up in height or what they're acting like in terms of behaviors. We don't know, I don't think, in terms of do we really do what I just said? That is, do we front load final height or do we front load growth? Do we change final adult height? So in other words, if we had a cohort of individuals from a generation ago that we never treated with growth hormone, now we have a group of kiddos growing up where we do treat with growth hormone. Do we see that the new generation is all 2 inches taller? Like, we don't have that. We haven't done that experiment. We don't know those data. If we do see any increase in final adult height, this is a guess, but my guess is it's going to be modest. It's not going to be like people are going to be 6 inches taller or 12 inches taller. It might be an inch or two, but I don't think it's going to be huge in terms of the difference. And that's just generally because, like I said, we're trying to override a system where the system itself is not broken. That's not really fundamentally what the problem is. Growth hormone also has other effects beyond just increasing growth velocity or increasing height. It also tends to change body composition, so tends to increase lean muscle mass or muscle. Not that you're going to be the Hulk or, like a, sort of bulging biceps or anything like that. But given that our children do have hypotonia, one thing I've seen is that we can see a little bit of improvement in terms of muscle tone and muscle strength. And so some people will see things like that. What's the downside of growth hormone? And again, this is all just general. This isn't based on OCNDS. If there's something else that could grow that you don't want to grow, you could be having an effect with that. So as an example, if there were any sort of cancer predisposition, is there at least the theoretical possibility that this growth hormone would also stimulate cancer cells to grow that you don't want to be growing? That theoretically is a possibility. Again, I'm not saying that this is something we've seen, but it's just a theoretical possibility. Another thing is that the medication itself is an injectable medication. So you have to, similar to insulin, you have to give it as shots. There's not another way to do it. And so for kids that may have, issues in terms of concerns, anxiety, things like that, it may not be the easiest medication to give. And the third one, and I say this mostly from practicing in the United States, is that the medication is not cheap. And so in terms of doing that, most families would want it covered by insurance, and most insurance companies have specific guidelines about whether or not the medication is covered. And usually that would be because there's evidence, actual experience showing that it will improve something. And again, we don't have that evidence for OCNDS. So it's very possible, if not probable, that insurance companies would say, no, we're not going to cover this because we don't have the evidence to show that it's actually going to improve things. And so if parents had to pay out of pocket, this can be quite expensive in terms of, and they have to decide in terms of where to spend their money. Is this the place to spend that money? And, depending on the family, that may not be a viable option. And I don't think families should feel badly about that, because I don't think it's going to make like an astronomical difference. If it's going to have any effect, it's going to be relatively modest. And I can't even say that it's going to have a positive effect overall. So anyway, if folks, though, do decide to use it for whatever reason, the one thing I do think would be good for us all to do is kind of pool that experience quantitatively. So people actually keeping either with their doctors or getting their records, but, an idea of when they started medication and then what happened with the growth charts afterwards. And it's pretty simple to do. You can get those growth charts from your pediatrician or endocrinologist.